Good morning, everybody. Dr. Patmos. It is May 7th, and there was an interesting post from Aaron Parnas this morning on a variety of topics. I linked it below. The main point he was talking about this morning was the realization in the administration that gas prices are likely going to torpedo the Republicans' chances in November. But I focused in on another part of Aaron's post this morning, and that is the revelation from a travel vlogger named, I think, Ruth Sennett, Cenet, who was on the cruise ship, the MV Hondius. That's the cruise ship that has the Hanta virus outbreak on it, where I think now 4 people have died from hantavirus and a couple more are sick. That ship is still sort of floating around out there, although a number of people were able to get off the ship and disembarked at an island off the coast of Africa. About 40 people disembarked. Some of them are Americans, and as far as we know, none of them are sick, but they disembarked and have returned, some of them to the United States. And that has raised questions about how is there a risk of spreading hantavirus among the general public. Now, hantavirus is a fairly recently recognized virus, hasn't been around that we know of that long. It is typically it's been associated with inhalation of aerosolized virus from mouse droppings and urine. And there have been a few notable cases where like Gene Hackman's wife died of it, and then he subsequently died a week later because she couldn't take care of him. There have been a few notable cases, but it's a really very rare virus. And there's one strain in Argentina that can be transmitted person to person, and that's apparently what's on this ship, although it still hasn't been made clear that there isn't a rodent issue on the ship as well. That's a very common problem in the maritime industry. So, for all we know, it could be both mechanisms, but certainly it appears that what happened on the HMV Hondius was person to person transmission of hantavirus. Well, the travel vlogger had some very interesting stuff to say about this. She described uh, being told by the captain that everything was fine, that the person who died on board the ship died of natural causes, and that they need not take any precautions. And so, for 2 weeks, activities on the ship, on the cruise ship, went along as per usual, with complete reassurance that everything was just fine. This is my point today is this is a really good example of failure to understand basic infection control and failure to follow basic infection control practices. I mean, we've seen this. I mean, most of the resistance to the measures that were necessary during COVID were the fact that people don't like infection control practices. That's not new. Those of us who are involved with infection control in hospitals have encountered this kind of resistance forever. I've been involved with infection control for decades. In fact, I was the chairman of the Infection Control Committee at Community Medical Center in Toms River, New Jersey, for a period of time back in the late 80s and early 90s. And we had a big outbreak of Clostridium difficile in the hospital. And I figured out that it was because they had carpets in patient care areas and recommended that those carpets be removed. And we got a tremendous amount of resistance from hospital administration at that time for doing so because it was expensive. And the lawyers said, well, maybe more people will slip and fall and we'll have lawsuits from broken hips and blah, blah, blah. Well, eventually they ended up pulling carpets out of patient care areas. And sure enough, that was the reason why there was such a significant outbreak of C. diff. And after pulling the carpets out, the C. diff rate went down. And now you won't find carpets in patient care areas and hospitals anywhere in the United States. But that was a perfect example of resistance to infection control practices that you'll see in hospital settings. Nobody likes infection control practices. They are a pain in the neck when you have to go from room to room and you're trying to make rounds and you're in a hurry and you have to gown, glove, and mask to go from one room to the next. And you got to take off the gown, glove, and mask in the ante room. And then when you go to see the next patient, you got to redo everything. It just adds a lot of time. It slows you down. It's a big pain in the neck, and it's also very expensive. All of that PPE equipment, personal protective equipment, costs money. So hospital administrators, they want to they want to really know that it's necessary. So infection control people get resistance all the time. That's not new. With COVID, it formed nearly the entire foundation for the resistance to dealing with COVID was the fact that people didn't want to wear masks, and you have these people out there claiming that masks don't work, and nobody wants to observe social distancing and quarantining and isolation and so forth. Look, infection control is unpopular. There's no question about it, but you have to do it if you want to prevent the spread of infection. That's just all there is to it. On the cruise ship, obviously, they have a doctor on the cruise ship, and that doctor probably or should have said to the captain, this might be a contagious virus. Maybe we ought to have people observe social distancing. Maybe we ought to have distribute masks or something, or have people wear masks. I mean, I would suspect that the doctor on board probably had some sort of advice to that effect, and the captain probably said, "Nah, let's just tell them everything's okay." Well, now everything's not okay. Four people are dead, and two others are sick, or at least three people are dead, and a couple of others are sick. I think it might be four. It's three or four. And now we got the issue of whether or not some of these people left the ship with hantavirus. Nobody knows. They did no contact tracing. They didn't. They left them off without, really doing the right kind of epidemiology work and infection prevention work that should have been done. So this is just a glaring example of a current news event where failure to abide by infection control is was manifest. It's a big problem. Underlying all of our COVID issues over the past few years is this reluctance to accept recommendations from infection control, and that needs to change. We need to begin to trust the recommendations of infection control people because, after all, they do know best on how to prevent the spread of infections. Now, it also, another point is, it didn't take long for the quacks to jump on the hantavirus thing to start selling ivermectin. In fact, the McCullough Foundation has already posted about this. They're already selling ivermectin online. If you think you've been exposed to hantavirus, you can buy ivermectin. There's no evidence that ivermectin is effective for any viral infection, let alone hantavirus. And it's just totally inappropriate just to do that, to jump right out and start selling ivermectin. And interestingly, former Congresswoman Marjorie Taylor Greene posted today that woohoo, ivermectin works for hantavirus, and she referred to it as good old horse paste is the way to deal with hantavirus. And she also celebrated the resistance to masks and gowns and gloves and all the other infection control. So in her post, in just a few words, kind of sums up the level of ignorance that we're dealing with here. Because on the one hand, it expresses um, uh, a refusal to follow infection control, coupled with the adoption of unproven, ineffective, unproven therapy with no basis for a recommendation to use ivermectin for prevention of symptomatic hantavirus. There's no data to support that. This is the level of ignorance that we're dealing with today. So I thought you'd find it interesting. I think the most important finding for me is the fact that I've said for years that the failure to follow infection control practices is a big problem, and there's a natural resistance to it. But if you want to control infections, you've got to listen to infection control experts. That's all there is to it. They're the ones who know how to stop the spread of infection in hospitals. And it's as inconvenient as it may be. If you want to stop the spread of infection, you got to follow infection control.